from the tissue outside. In a low blood level called anemia, the patient is almost incapable of transporting this oxygen simply because there are fewer number of cells that can do this. This is called anemia. That's when the hematocrit falls below the reference range. Hence, life really as it is can really not go on in the absence of blood.
Okay, so it's all important for us to have blood in the blood bank. Now let's talk about the screening process.
Okay.
First, who is eligible to donate blood? And then after this is done, what is the process like?
Okay, thank you. In Nigeria, we recognize the ages 18 to 60, 65. But if an 18-year-old man approaches the blood bank or a lady, we'll first of all look at I personally would like to call it extrinsic test and intrinsic test. Extrinsic means the appearance. Someone comes with wounds all over, with boil here and there, not looking healthy, jaundiced eye. You cannot go ahead and you don't even need to collect blood from that person. You don't need to screen for any other thing. That person himself or herself needs attention. So one, you exclude people like that. Then also we look at things like the blood pressure, the weight. We check the weight. Anybody below the 50 kilogram will be excluded. Then after that, all these things have been checked. We check the hemoglobin level. This hemoglobin level tells us how much blood does this person have before he or she wants to donate. Then the person is asked to fill questionnaires that ask questions like sexual habits, do you smoke, are you sick, are you a sickle cell patient? All this kind of thing helps us to decide who can donate and who can't. Then the intrinsic is after we have asked this question and we are sure that this person can donate blood, then we withdraw just a little part of that blood for testing to exclude the TTIs. TTIs are transfusion transmissible infections, which include the HIV, hepatitis B surface antigen, and then the HCV, hepatitis C virus. We screen this blood. Then if the person is free of these TTIs, then the person is bled. The person is eligible to donate the blood.
Okay.
Yes.
Okay, and before I go into how long it takes to take the blood, how much blood, for instance, I want to donate, how much blood will I need to have? How much pints of blood will I need to have within me before I can give out one or two?
Okay, the average cardiac output of a grown human being is about 4.5 to 5 liters. That's about 10 pints of blood. And averagely, you need, out of that 10 pints, you need 7 to 8 to be alive, to be well, to be fine. So we'll do your PCV or hematocrit to determine your blood level. That blood level tells us, okay, this person has more than enough. Hence, you can donate.
Okay.
Whosoever has less than that will be excluded.
Will be excluded.
Yes.
Okay, maybe for that moment, you can
yes.
go
Yes.
show up the blood volume.
Yes.
Okay, now before the process, is there anything, for instance, I want to donate? Is there anything I must have eaten or whatever, something I must have done to make sure that the process is safe enough?
Yes, we advise our donors to eat before coming to donate. Or sometimes, if we are on field work, like the MBTS does field work, they go to universities and the likes. I believe the University College Hospital also does field works. If you're on field work, we go along with our food. We feed this donor before bleeding them because it gives them stamina after the donation so that they don't feel dizzy or unwell. So we advise them they must have eaten and they shouldn't be fasting and they shouldn't be on drugs.
Okay, but some people do have this fainting episodes after donating blood.
Yes, that's true. I actually have a friend, we donate often together. And each time he donates, he has the episode. But I found out that most of the time, this is more psychological than it's not pathological. It doesn't have to do with, it's not because the person is not well or because the blood was withdrawn. Sometimes it's psychological. So we advise or we maintain this stand that after donation, you don't stand up from the couch. You lie down there for 15 to 20 minutes. For you, your blood pressure should return to normal. If it's elevated, then it should be relaxed so that you can continue with your normal day's job.
Okay, is it just lying down? Is there any other thing the person needs to take?
No, we give refreshments. Some people, I've seen people who, after donation, we ask them, do you want to take some? They say no, they feel fine. So it depends on the donor. Some of them just say, I don't want. Some, they take the refreshment.
Okay, and from when the needle goes into the veins, how long does it take to take out a pint of blood?
We're taking 450 mils. That's about 45 cl, centiliter. And then it varies. The time, the period varies. 4 minutes, 7 minutes, depends on the blood flow, the pressure for which the blood is flowing. If the pressure is high enough, within 4-5 minutes, the bag is full. But if the blood is slow, maximum 10 minutes.
10 minutes.
The bag is full.
Okay. Okay, now let's talk about how many times in a year can an individual donate blood?
Okay. For a male, the male generally has a hemoglobin level, that's blood level, that is higher than that of the female. Then plus the fact that the female goes through these menstrual sheddings every month. We advocate for 4 months for females and 3 months, every 3 months for male. So averagely, a female can donate 3 times a year, a male 4 times.
And there would not be any side effects to it. Okay, but we still find that people have fears when it comes to blood donation. You know, there's a whole lot of myths around you giving out your blood to somebody and all of that. Let's talk about this.
Yes, that has contributed so much to the challenges that Nigeria is having in achieving 100% voluntary blood donor, because people are not aware of the importance of blood donation. There are traditional or cultural values that we attach to blood that may not be 100% true, but may be difficult to remove from people's mind. That's why we need to make them aware. We cannot
some of this
out.
cultural, myth?
Some believe that if someone, if you can transmit genetic diseases, which is not possible, it's not always possible. What can be transmitted? I told you there are TTIs, transfusion transmissible infections. That is only when those blood contain those viruses and they are not well screened. But apart from that, blood does the job of carrying oxygen, removing, carrying waste to the kidney, and then transporting nutrients from one place to the other. It doesn't. People believe that a part of themselves, that's traditionally or culturally, when you give blood to somebody, a part of you is inside that person. It is yes and no. Yes, because it's your blood. No, because it's still blood. Everybody has it. There are different blood types. That's where compatibility testing comes in. But apart from that, it's totally safe. Of course, there are religious factors too. There are people who believe that you don't take blood. Under no circumstances should you. Sometimes it may be difficult to question things like that. But we need to make people aware and educate them. Maybe they will be more predisposed to donating blood.
Okay, and some of this myths, as you say, they have no basis, and
no,
so people should be able to go out not just to donate blood, but also if they are in need of it, they can get. And yes. Donating this blood, after taking it, is the blood just for transfusion, or it could be used for other things?
Yes, we call it blood and blood products because a pint of blood can be separated into different components. If you spin it down, you can have fresh frozen plasma concentrate for different conditions. And most of the time, it is even advised that physicians that would make requests for blood should rather make a specific request and not just keep transfusing all blood into the patient. So the blood can function in different. For very anemic people, use the pack cell. That's you remove the plasma. For people with burns, you may need more of a platelet concentrate. For people with bleeding disorders, you may need factor 8, which we don't really produce in Nigeria. I don't think there's somewhere where you do that. You concentrate factor 8 because you need about 250 pints of blood to get a concentrated factor 8. But it's good that blood is separated into various components and given after it has been screened and then the compatibility test has been done.
Okay, we'll just take a quick break, and if you're watching at home right now and you have any question, you have comments, you can join us after this break.
Catch the thrilling moments of football actions as primary schools from 12 states of the Federation and Lagos log it out in Season 5